Hi guys, I hope nobody minds, but I just wanted to make this video as I'm really deeply troubled at the moment. I've been thinking about this all day and I really can't get it out of my mind. You know, it really saddens me that for many, many years now, the Philippines has been the brain drain of the world. All the world has tapped into the Philippines for its overseas workers. You only have to look at the Middle East. There are so many Filipinos in the Middle East, maybe over 2 million Filipinos in the Middle East working for Saudi Arabia, for Qatar, for Dubai, for Abu Dhabi, for Bahrain, for many of the Gulf states. And the other side of the coin is that there's so much money in these Gulf states because of oil. They've got absolutely billions and billions of dollars. The other thing to think about is there are so many Filipino nurses as well in the Middle East, as well as in America as well. You look at the thousands and thousands of Filipino nurses in America. This is really a brain drain on the country. I understand the reasons, but all the same, the Middle East and America are very, very lucky to have all of these Filipino nurses and Filipino workers. The same thing can be said for the United Kingdom. We have over 17,000 Filipino nurses in our National Health Service. Now, the way I see it is this. Right now, all these Filipino nurses around the world are vaccinating us with coronavirus vaccines or COVID-19 vaccines. There are at least 3 vaccines that have been released in the UK at the moment, or at least approved in the UK at the moment. Obviously, first we had the Pfizer vaccine, and then of course we had the Oxford vaccine, and the other new vaccine as well has just been approved. Now, what gets me is, here you have these Filipino nurses, for example, in the United Kingdom, and they are vaccinating fellow British citizens, including myself, not only Filipino nurses, but I want to talk about Filipino nurses. Here you have these Filipino nurses here in the UK vaccinating us with the Pfizer vaccine or the Oxford vaccine soon to be. And yet, these Filipino nurses know that in their own country, in the Philippines, there still is not an availability of vaccines. Now, the way I see it is this. I understand that the Oxford vaccine won't be available in the Philippines until maybe June or July. Now, I can't understand that. I can't understand either why there are so many Filipino workers in America vaccinating American citizens, and yet the Philippines won't get its own vaccine until later on in this year. Now, what gets me is this. Here you have a Filipino nurse. She's working her guts out. She's working incredibly hard. She's doing overtime. She's very, very stressed. She's very, very tired. She's working incredibly hard. She's giving her life and soul to the job. But she knows that back home in the Philippines, her elderly parents or his elderly parents in their 90s are not able to be vaccinated because of a shortage of vaccines or because the vaccines haven't been delivered to the Philippines yet. I think it's common decency for Western countries or for first world countries or developed countries, whatever terminology you want to use, I think it's common courtesy and common decency for these developing countries to give all of the resources necessary to give either free vaccines or to give the financial resources to the Philippines to acquire as many vaccines as they possibly can. Now, people have been talking about this Chinese vaccine in the Philippines. I fully understand that the government needs to get hold of as many vaccines as it can, because COVID-19 cases are on the rise in the Philippines. And the only way that the Philippines can vaccinate its own population is by getting hold of any vaccine that it can get hold of. And that, of course, includes the Chinese vaccine. I'm not sure of the name. So I don't blame the government for 1 minute for acquiring whatever vaccines it can get hold of. And apparently the quickest vaccine that the Philippine government can get hold of is the Chinese vaccine. But likewise, I would hope that the UK vaccine, the Germany-America vaccine, would be sent to the Philippines tomorrow. I cannot understand why millions of these vaccines can't be sent to the Philippines, because it's all very well for the world to brain drain the Philippines. It's all very well for the world to take Philippine nurses to their own country and rob them of the Philippines. And on the other hand, what are they giving in return? Yes, these Filipino nurses are getting paid. Of course, I accept that. But is it right, and I think this is a moral question, is it right that these Filipino nurses are vaccinating our British citizens, or these Filipino nurses are vaccinating USA citizens, and yet their own parents aren't being vaccinated? And is it right that healthcare workers in the Philippines aren't even able to vaccinate themselves or vaccinate each other because the vaccines simply aren't available in the Philippines? I think this is morally wrong. I would hope that the UK government and that the United States and Germany and all the other countries, and of course the Middle East, would immediately send the right amount of vaccines that are needed in the Philippines. And make sure, why am I hearing at the moment that the Philippine government has to partner with private companies in order to be able to pay all of these vaccines? Why are these vaccines not fully covered? Why is the Philippine government, who's already in debt, who's already looking after its people and doing the very best it can to support its citizens, why are they having to come up with billions and billions of pesos for these vaccines when there are enough billionaires in the world to ensure these vaccines are completely free? I worry. You know, I've had the Pfizer vaccine myself and I'm very, very grateful. But I'm really worried and I'm really aggrieved and I'm really angry and I'm really, really upset and frustrated that the COVID-19 vaccine is not yet available in the Philippines. And obviously working within the healthcare sector myself, you know, I just think, here we are in the UK, we've already had these vaccines, but people in the Philippines who so desperately need them because there aren't the same intensive care facilities in the Philippines, there aren't the same level of medical facilities in the Philippines, so surely they need them before us. If it was me and I could have given my vaccine to a frontline professional in the Philippines, like a nurse or a doctor, I would have given my vaccine so that this nurse or doctor could do their job saving lives of Filipinos. This is an issue that really needs to be looked at. I don't know if there's a way forward, but as I said, on the 1 minute other countries are robbing the Philippines of their skills or of the brain drain of the Philippines, and on the next minute they're not delivering vaccines to the Philippines for 6 months. That doesn't seem right to me. I think the world owes the Philippines a debt of gratitude. I think the very least that the world can do to thank the Philippines for all of these overseas Filipinos who've gone abroad is to immediately ensure 100 million doses at least of the vaccine are immediately sent to the Philippines. I know it's only a dream and I know it's only an aspiration of mine and I'm sure it's not even possible, and I don't understand all the reasons, I don't understand all the logistics. I understand that these vaccines, there aren't enough of these vaccines made, I understand that. And I understand that, of course, there's a waiting list for the world. But why is it right that developed countries, why is it right that we in the UK are getting this vaccine before the Philippines, when in fact it's the Filipino people, our Philippine nurses, who have been looking after our British citizens for the last 3 or 4 decades? I believe that developed countries or Western countries should immediately repay that debt of gratitude by paying for all of the vaccination program in the Philippines. I know it's a big ask, but I think it's only fair. This is the time that the Philippines needs the help and support of the wider world. As I said, look at all these Middle Eastern countries where there are Filipino workers. Why isn't the Middle East going round to the Philippines or going back to the Philippines and saying, thank you so much for everything you've been doing for us, and we will pay for all of your vaccines so that all of your parents, your grandparents are properly vaccinated? This is my thought, this is my view. As I said, I've been thinking about this all day. I don't really know how to take this forward, but I just think it's a little hypocritical almost that all the developed countries, all the Western countries are happily vaccinating each other, but countries such as the Philippines have got to wait until we've all been vaccinated. Is that fair? Is that right? You know, Filipinos are citizens of the world as well, and I believe they have just as much right to be vaccinated at the same time, if not before anybody else, because after all, the Philippines has been the backbone, if you like, of the Middle East. The Filipino people have been the backbone of the United States, the backbone of the United Kingdom. So why are they down the bottom of the list? Why are they down the pecking order? Why are they not receiving the vaccine at the same time as the UK or at the same time as the USA? At the very least, for medical personnel like nurses and doctors and healthcare professionals, they should be vaccinated in the Philippines tomorrow. And nobody should have to pay for those vaccines. Those vaccines should be given by the UK, by the United States, and by the Middle East. And this is my point. I don't really know how to progress this thought, but I just think that that's what we should be doing. Anyway, guys, thanks very much for watching. I welcome your comments, I welcome your opinion, and I would ask that you can share this video and you can kindly think about how we can progress this. Thanks so much. Best wishes, guys.